Hello everyone, Ricky Morgan here with Morgan Physical Therapy, and today I'm going to talk about some of the most powerful things that women 45 plus can do for their health, and that's strength training. Strength training protects your joints, improves your balance, keeps you mobile, and yes, tones and shapes your muscles beautifully. I want to talk with you all about why strength matters, especially as we get older or with age. And one of the biggest reasons is to reduce the risk of falling. As you probably all know somebody that has fallen due to poor balance or poor strength and has broken a bone. So as we age, our bones actually become weaker or more brittle, so more easily to fracture them, right? So maintaining your strength does multiple things. It allows you to improve your mobility, to improve your balance, to give you the strength and reduce your risk of falling, but it also strengthens your bone. So there's a lot of ways to strengthen bones. One of the things that most people worry about is osteoporosis and osteopenia. And when you have those diagnoses, you're at a higher risk of a fracture in your bone. But when you strength train and you're consistently strength training, it increases the strength of your bone so that it can actually reverse the role of osteoporosis and turn it back to osteopenia, and then osteopenia to nothing. But you have to be super consistent. You got to follow very specific exercise regimen, and finding a professional that is well trained in exercise, like a physical therapist, to help guide you through those types of exercises. So one of the biggest things for strength training is to be consistent, to make sure you're moving enough load safely, and that can help increase your strength. Of course, it can help increase your balance or improve your balance, and it can help have healthier bones or stronger bones. And bone health is super important as we age. As we continue to talk about strength training, there's three really main muscle groups that women over 45 tend to forget about or overlook. And one of them is actually an abdominal muscle called the transverse abdominis. The transverse abdominis goal is not necessarily to show like your six pack, if you will, or your abs, but it is built for kinesthetic awareness. So what that means is it gives you stability within your spine so that the rest of your body can move appropriately. So the transverse abdominis is one big one that tends to be overlooked, and it's actually quite hard to fire. If you're not sure how to do it, please reach out to our team and we're happy to help talk you through that. A second muscle that is definitely overlooked is like back muscles. So postural muscles, back muscles, we tend to work on mirror muscles, so the muscles we can see in the mirror, but back muscles are super, super important for sustained postures, for sitting, for lifting, and just for reducing injuries elsewhere within your spine or your legs. The third muscle that I think about is the shoulder girdle muscles, and the shoulder girdle muscles are built to stabilize the shoulder, of course, but also the shoulder blade and help you reach above your head and continue doing those activities as well. So activities that people really enjoy doing, pickleball, for example, if you don't have great core strength, you don't have back strength, and you don't have shoulder girdle strength, those are areas of weakness and they can increase your risk of injury. So make sure you pay attention to those three groups of muscles. Again, the shoulder girdle muscles, the transverse abdominis or one of the abdominal muscles, and then back muscles. Those are the three that are often overlooked. I think for many females and many adults in general, many of you want toned muscles, if you will, or you want to be able to see the muscle, you want to look good, you want defined muscles. So I'm here to talk a little bit about toning and strengthening and what is the difference. So toning, what does that actually even mean? Like, what is the true definition? I think most of us think of it as like well-defined muscles or muscles that you can see easily. Another word that I like to use is hypertrophy. So when you think of hypertrophy, I don't want you to think of being like bulky and like a bodybuilder or muscle builder. It's just defining those muscles a little bit more. So many people talk about that as toning, when in reality it is hypertrophy. And so you see the muscles and the outline of the muscle a little bit better. Strengthening, you're moving a heavier load and you're building strength. So of course you can move heavier loads for, like, if we break it down into repetitions, strengthening is more of that 5 to 6 repetitions, right? As a heavy load, 85 to 90% of your 1 rep max typically. And hypertrophy, or toning if you will, but hypertrophy is more of that 8 to 12 repetitions, and you're moving at least 67% of your 1 rep max. So again, toning and strengthening, there is a difference. I think it's super important to focus on hypertrophy. I think it's super important to focus on strength, and I think it's very important to focus on endurance. And all of those categories I just described require a different amount of weight and a different amount of rep scheme. So if you're always doing the exact same thing all of the time, your body's going to adapt and become used to it, and it's not going to feel challenged. So then you'll see a plateau in your gains or what you're trying to reach. So remember these things: endurance, hypertrophy, and strength. All of them are super important, and there's a time and a place for each of them. Just because you're building strength or you're working on hypertrophy doesn't mean you're going to be a bodybuilder. You have to do very specific things, and your calorie intake has to be in a surplus if you want to build muscle, right? And build hypertrophy. So just some things to think about. Toning versus strengthening, there is a little bit of a difference. Toning, I don't know. I mean, it's a slang word, I believe. It's more hypertrophy is what you'd be looking at. So there's a difference for you all. I would like to talk to you about how recovery tools can help you stay consistent. So recovery tools can be any sort of technology, any sort of device, any sort of technique really to help you recover appropriately. So what that means is after you do an exercise or before you do an exercise, what are you doing for your body to make sure that it's able to recover? Are you taking rest days? Are you using technologies such as like compression boots or regenerative type of technologies such as radial pressure shockwave, focused shockwave, EMTT, red light therapy, stim pod? All of these things help you recover at a quicker rate. So your muscles can adapt, your bones can adapt, you can recover in a nice way so that you can continue to progress with your strength routine. So recovery tools are very, very important in helping you progress and reach your health goals. And so please reach out to our team if you have more questions on our recovery tools. Also, if you follow my channel, you will have access to me discussing each one of those recovery tools. So please take a peek at it. And if you're interested, let us know. We're happy to set up a free session for you so you can experience what it's like working with those regenerative technologies and recovery tools to best fuel your body so that you can continue to reach your goals. Big question that I get often is what's the safe way to start strength training? Or how do I start strength training? Or I want to start strength training, but I'm in pain. So all those are very, very common questions. And each one of you watching this are going to be in a very different spot. Some of you are going to be advanced with exercise and strength training, and you're going to know how to do some of these more complex lifts. Some of you maybe have never lifted before in your life, like gone to a gym and actually lifted weights. So each one of you would probably have to start at a different spot based on the program and your goals as well. So a safe way to start strength training is to take advice from a health professional, like a physical therapist. We're very well trained in how the body moves and how to improve flexibility, how to improve balance, how to improve strength, but also how to progress appropriately so that you can reach your goals. And I would also consider looking for somebody that has some sort of strength and conditioning background in addition to like a healthcare background, because if you're dealing with a lot of pain, it's super hard to load it with weight and start exercising because it hurts, right? So make sure you understand what you can do to reduce your pain and then progressively ramp up to lifting those heavier weights. So a safe way to start strength training is to find a healthcare provider that is willing to watch how you're moving, understand your specific goals, and give you some places to start, but then also be able to modify those exercises that are specific to you so that you can reach your goals. So like I said, many of you would start at different spots with a workout routine. And when you start with different spots, it's hard for me to give you a generic answer here right now. But if you're interested in our team helping you build a strength program, please reach out for a free discovery session. It can be on the phone. It can be like virtually FaceTime or Zoom, or you can come into our clinic and we are happy to talk you through what things maybe to start with, what to look out for, good form versus bad form, what's best for you individually, and what's going to help you reach your goals. So that to me is a really safe way to start a strength program and make sure that you stay healthy for as long as we possibly can. Again, our goal at More Gain Physical Therapy is to help people arrive well into their 80s and 90s and feel like they're 60. I definitely want that. I know most of you want that. So let's start the journey together to better health. If you're ready to feel strong, steady, and confident again, please reach out to our team for a free discovery visit and let us help you create a strength plan that is specific to you to help you reach your goals and allow you to arrive well into retirement, well into your 80s and 90s, feeling like you're 60, staying active, mobile, and free from pain medicine.